Hi everyone, welcome back to the Nurse Navigator Network, where we take your NCLEX prep to the next level. In today's video, we will dive into one of the most important test-taking strategies that you will need to pass the exam. Watch until the end, and we will share the answer to one NCLEX question that is guaranteed to be on every single exam. So stay tuned. One of the most common struggles on the NCLEX-RN is separating what you've seen in real life as a nurse from what the textbook says you should do. So today we're covering 10 NCLEX practice questions that will help you to stay focused on what the exam wants, not what you've experienced in clinicals or practice. Let's get started. Before we dive in, here's a tip. The NCLEX isn't testing your real-world judgment. It's testing whether you can apply safe, evidence-based, textbook-approved nursing principles, even if you've seen something handled differently in real life. For the NCLEX, always choose the ideal textbook answer. The exam just needs to know that if you find yourself in a tight spot, you can exercise good judgment. So let's go ahead and just get into these questions. Question 1. A nurse is caring for a patient with a tracheostomy who is experiencing respiratory distress. What is the first action the nurse should take? 1. Call the respiratory therapist. 2. Remove and replace the tracheostomy tube. 3. Suction the tracheostomy. 4. Administer 100% oxygen via a non-rebreather mask. Take a moment to think about this one. The answer? Number 3. Suction the tracheostomy. In real life, you might call for help immediately or consider replacing the tube if it's dislodged. But the textbook says you should prioritize suctioning to clear the airway and address the respiratory distress directly. The NCLEX tests your ability to follow standard protocols. Question 2. A patient reports chest pain 2 days after a total knee replacement. What is the priority nursing action? 1. Administer prescribed pain medicine. 2. Perform a respiratory assessment. 3. Notify the healthcare provider. 4. Encourage the patient to ambulate. The answer? Number 2. Perform a respiratory assessment. In practice, you might be tempted to call the provider right away, but the NCLEX focuses on prioritization. Chest pain after surgery could indicate a pulmonary embolism, and assessing the patient first provides crucial information before notifying the provider. Question 3. The nurse is caring for a patient with end-stage cancer who is in severe pain. The family asks if increasing the opioid dose will cause respiratory depression. What is the nurse's best response? 1. We'll need to consult the provider before making any changes. 2. The focus is on keeping the patient comfortable, even if it affects breathing. 3. Let's discuss alternative pain management methods first. 4. Opioid doses are adjusted carefully to minimize side effects. The answer? The focus is on keeping the patient comfortable, even if it affects breathing. So that will be answer number 2. The rationale. In reality, families may receive nuanced discussions or reassurance, but the NCLEX expects you to demonstrate an understanding of palliative care principles. Comfort is the priority in end-of-life care, even if it risks respiratory depression. Question 4. A nurse is preparing to administer digoxin to a patient. The patient's apical pulse is 58 beats per minute. What should the nurse do first? 1. hold the medication and notify the provider. 2. Administer the medication as prescribed. 3. Recheck the pulse in 30 minutes. 4. Ask the patient about any symptoms of dizziness or nausea. The answer: hold the medication and notify the provider. Answer number 1. And the rationale is, textbooks teach that digoxin should not be given if the apical pulse is below 60. In practice, you might take other steps like monitoring symptoms, but for NCLEX, always follow the exact parameter. Question 5. A nurse receives an order to administer 2 liters of oxygen via nasal cannula to a patient with COPD who has an SpO2 of 88%. What is the best action? 1. Administer the oxygen as ordered. 2. Increase the oxygen to 4 liters per minute. 3. Call the provider to question the order. 4. Encourage the patient to perform pursed-lipped breathing. The answer? Number 1. Administer the oxygen as ordered. In real life, you might adjust oxygen levels based on the patient's needs or consult the provider. For NCLEX, though, follow the safe, ordered intervention unless there is a clear contraindication. Question 6. A nurse is administering a blood transfusion. 15 minutes after the transfusion starts, the patient reports chills and itching. What is the first action the nurse should take? 1. Slow the infusion rate and monitor the patient. 2. Stop the transfusion immediately. 3. Administer diphenhydramine or Benadryl as prescribed. Or 4. Notify the healthcare provider. The answer? Number 2. Stop the transfusion immediately. In real life, you might consider additional actions such as monitoring or administering medications. However, the NCLEX expects you to immediately stop the transfusion at the first sign of a reaction to prioritize patient safety. Question 7. A nurse is teaching a patient with newly diagnosed hypertension about lifestyle modifications. Which statement by the patient indicates the need for further teaching? 1. I'll limit my sodium intake to 2,300 milligrams per day. 2. I'll start walking for 30 minutes, 5 times a week. 3. I'll drink no more than 2 glasses of wine per day. 4. I'll add potassium-rich foods like bananas to my diet. The answer? Number 3. I'll drink no more than 2 glasses of wine per day. According to the textbook, patients with hypertension should limit alcohol consumption to no more than 1 drink per day for women and 2 drinks per day for men. The NCLEX tests your understanding of ideal guidelines, even if patients in practice may not strictly follow them. Question 8. A patient is receiving IV vancomycin. During the infusion, the patient develops flushing and redness of the upper body. What should the nurse do first? 1. Stop the infusion and notify the provider. 2. Slow the infusion rate and monitor the patient. 3. Administer an antihistamine as prescribed. 4. Document the reaction and complete the infusion. The answer? Number 2. Slow the infusion rate and monitor the patient. Why was this the answer? Well, this reaction is consistent with what's called red man syndrome, which is not a true allergic reaction but a rate-dependent side effect. The textbook advises slowing the infusion as the first step, not stopping it unless symptoms worsen. Question 9. A nurse is assessing a post-operative patient with a Jackson-Pratt drain. The patient asks why the drain is being used. What is the best response? 1. It helps to remove excess fluid and promote healing. 2. It measures the amount of bleeding you are experiencing. 3. It's used to prevent infection in the surgical site. 4. The doctor ordered it to monitor your recovery. The answer? It helps remove excess fluid and promote healing. So that would be answer number 1. In clinical settings, you might provide a more detailed or situation-specific answer. The NCLEX, however, focuses on clear, textbook-defined purposes for medical interventions, and the primary purpose of a Jackson-Pratt drain is to remove fluid and support healing. Question 10. A nurse is preparing to administer medications through a nasogastric or an NG tube. What is the priority action before administering the medication? 1. Check the tube placement by aspirating gastric contents. 2. Flush the tube with 30 milliliters of sterile water. 3. Administer medications one at a time. 4. Verify the medication orders with the provider. The answer? Number 1. Check the tube placement by aspirating gastric contents. You definitely always want to remember to aspirate before pushing anything through an NG tube, but in real life, nurses may rely on clinical judgment or skip steps due to time constraints. However, the NCLEX expects you to follow the textbook priority. Always verify. You want to verify that tube placement before administering anything to ensure patient safety. As you've seen, real-life experience can sometimes conflict with textbook answers. For the NCLEX, stick to what the guidelines recommend and focus on what's safest, most evidence-based, and ideal. So as a quick review, those were 10 great questions to help you to think like the NCLEX. Remember, even if you've seen things done differently in real life, always go with the textbook for this exam. It's all about showing that you understand nursing principles and evidence-based practices. Just remember that part. Now, for that bonus question that you were guaranteed to run into somewhere on the NCLEX. And it is about what else but hand hygiene. You may see hundreds of different variations of this question. Here are just a few here. What is the number one way to prevent infection? It's generally not written that simply anymore, but here's a few different examples of how it could be written. One is, which intervention is most effective in preventing the spread of healthcare-associated infections in a hospital setting? Or, a nurse educating a group of students about infection control. Which statement by a student indicates a need for further teaching? So, questions like these, pretty much they're all pointing to hand hygiene. The main thing to always remember, the number one way to prevent the spread of infection in any healthcare facility is hand washing or hand hygiene. Hopefully when you run into this question on your tests, you think of us. If you found this video helpful, hit that like button, share with your fellow nurses, and don't forget to subscribe for more practice questions and test-taking tips. Check out our next video that covers another super important test-taking strategy. Take care, and I'll see you in the next video.